I'm from MUP, which is a technology company that's founded in Japan, and we're working on AI health. I also wear an alternative hat. I'm also an investment banker and an economist with AT Capital, so hopefully I can bring in some of those themes. We have an excellent panel today, and I think we cover quite a broad spectrum of different views, from technology to human trafficking resilience to getting a donor perspective as well. And I'm excited about the panel, and hopefully we'll get a lot of questions from the audience, because this is a Frugal Innovation Forum, and the theme for the forum is scaling resilience, and the subject today is how can we scale, what are the opportunities from scaling resilience? So let me start by talking about the challenges and the opportunities when we think about scaling resilience. And I think one of the core themes I wanted to throw out there is that the scale of the problems and the lack of resources is one of the biggest challenges, but it's also one of the biggest opportunities as well. And I think it's really one of the drivers of innovation in countries like Bangladesh, and we've barely touched the surface of it. The famous book by C.K. Prahalad, Fortune at the Bottom of the Pyramid, which I'm sure many of you are familiar with, and if you're not, it's well worth reading that. That was kind of the pivotal piece on innovating amongst the poor and ultra poor, and how new economic opportunities emerge. And actually, the Frugal Innovation book that is part of came out of the University of Cambridge, and I think is part of the theme for this conference. Also has a lot of interesting innovations, and I'd recommend you read the book if you haven't already done so. But I also wanted to start by giving a few examples. I think that the Fortune at the Bottom of the Pyramid and some of the innovations there were say low-tech and low-cost innovations, and they remain critical. And there was a great example of 1 rupee packets of soap for Unilever. That was an innovation that ended up creating a lot of a whole new market and a whole new economic opportunity. But I think that technology, which is one of the areas I'm focusing on a lot, is also creating a lot of opportunities to scale resilience. And I want to give a couple of examples touching on technology and how that creates the opportunity to scale resilience. Also talk a little bit about climate change as well, and medicine, and then I'll pass it along to we'll start the discussion on the panel. I'm also going to we'll have slightly less time on the panel, so we can have plenty of interaction and questions from the audience, because as I said, this panel actually is the central core discussion of theme of the conference itself. So just coming back to my own experience, or my own current focus with MUP. MUP is a Japanese artificial intelligence and big data analytics company. There's several professors from the University of Tokyo, and they're doing a lot of cutting-edge innovations in the area of artificial intelligence and clinical diagnosis systems. They've launched a product last year in Japan, or we've launched a product last year in Japan. And once I heard about that, and they were also thinking, can this be applied to a developing country like Bangladesh? And actually, in that sense, whether you look at MUP or IBM Watson or other artificial intelligence systems, they were still at the frontier in developed countries. So in some sense, that seemed a bit, is that too much of a stretch to think of these expert systems in a country like Bangladesh? But actually, what's interesting in thinking about the AI health, the AI health project that we're also in discussions with BRAC about, can it be scaled and deployed in rural Bangladesh, is that firstly, on using artificial intelligence and computer systems, the need is actually much greater in countries like Bangladesh than it is in Japan. In the case of healthcare, we have in Japan, there's 30 doctors for every 10,000 patients. In rural Bangladesh, there's 1 in 15,000. So if you need, computer-based clinical diagnostic systems, you should be having them where there's less doctors. The other interesting observation in developing this project is that the AI, or the core technologies, our ambitions in Bangladesh are actually much greater than they are in Japan. So again, the scale of the problem, so coming back to one of the themes I wanted to explore in the session and get feedback from the panelists and people in the audience, the scale of the problem is also part of the opportunity. The scale of the problem is that we have not enough doctors in Bangladesh, we don't have the resources, but that scale is also the opportunity for looking at artificial intelligence. And one other, I won't get into the technical side of it, but artificial intelligence uses machine learning. And machine learning is about how much data you feed the computer. It's like you're trying to teach the computer to think. And one thing we have in Bangladesh, and BRAC in particular, it has is massive scale. So we have potentially access to millions and maybe tens of millions of patients. So in addressing the problem, which is offering low-cost health solutions to the poor and the mass of Bangladesh, that also will make the artificial intelligence system much stronger. So again, it's thinking about the opportunity and the challenges of scale and seeing that is something that is building resilience. A second example I'll give is there's a Silicon Valley venture capital fund called DEFTA Partners, and they're looking at developing a disruptive technology fund. Interestingly, the other fund they're developing in Silicon Valley is actually on kind of cutting-edge skin cell regeneration technology that's based on the recent Nobel Prize winner in Japan. So they're at the very frontier of medicine, but the other fund they're looking at is a disruptive technology fund from Bangladesh. And again, that reflects their expectations or their optimism that disruptive technologies can happen in a country like Bangladesh. And scale, and the scale of the problem is a critical element in that. So when I heard about this fund, I actually suggested to the partner from DEFTA who was visiting Dhaka, why don't we go and speak to BRAC, and it's particularly Morshid Bhai, I think maybe in the audience. And I said, BRAC is actually doing a lot of interesting things in technology. Let's exchange some views and see what they think. And in that discussion, we had, one thing that came up was actually in the agricultural sector. So BRAC has 1.6 million cows, and Moshe Bhai was talking about, can we use RFIDs, these electronic circuits, in cows? I remember and how can we use that to increase productivity, for example? So the first, when I left, the first thing that struck me is, well, how cool is that? We have wearable tech for cows. So it's kind of the way I looked at it is like Fitbit for cows. So that's a pretty cool concept, and I think something you wouldn't think about in Bangladesh. But what is the practical importance of this? Coming back to resilience, well, some of the panels yesterday, we discussed one of the biggest challenges in climate change is by 2050 we have Bangladesh will lose 15 to 20% of its land area, but its population will go up to 200 million. So agricultural productivity is critical. And Afsan Appa in yesterday's health session mentioned that one of the biggest health challenges for Bangladesh is malnutrition. So, this issue of agricultural productivity touches many areas. And technology, again, is something which can help. It's something that will be an enabler to help, scale resilience. It's a major opportunity. Specifically in agriculture, I think big data analytics in agriculture is something which we can and will explore, I'm sure. How can we increase agricultural productivity? And how can we take the experience through the BRAC network to extend that learning into other countries throughout Bangladesh, but in the rest of the region? The third area I wanted to touch on is climate change. So again, on climate change, I see the scale of the challenge in climate change. It is a massive challenge. We talked about it yesterday, but it's also a massive opportunity. Tom Friedman wrote a book, Hot, Flat, and Crowded, on climate change, and he mentioned that climate change is the biggest challenge mankind faces, but it's also the biggest biggest economic opportunity since the Industrial Revolution. So trillions of dollars are going to be invested in the next several decades in climate change. So can Bangladesh also be an innovator in a green economy? And again, thinking about the challenges, scaling those challenges, and the economic or other opportunities to innovate. And the last thing I'll say, and then we'll get some views from my fellow panelists. I remember Mustafa yesterday was talking about, he mentioned, we don't want to, it's not do sort of genomic testing for TB or molecules. And actually, that's another area. I think both biotech and genomics is also an area in technology which is going to profoundly change the opportunity set in countries like Bangladesh, because the cost of genomic testing, we now have a $1,000, the whole human genome costs $1,000 to sequence. The first human genome cost $1 billion. So again, we're seeing technology reducing the collapse in costs in genomic testing is going to throw a lot of new opportunities in both healthcare, in agriculture, and in plants as well. So I think that there are a lot of interesting things going on, and it's not all high tech. The other example I'd give when you think about climate change and adaptation is when you look at climate change adaptation, there's a company called Tartary, which is started by the co-founder of Friendship, and he's looking at fiberglass boats as a way of increasing weather resilience. And there are 1 million wooden boats in Bangladesh, so that's a massive challenge. But you're using not necessarily very high tech. There's another major opportunity, and across climate change adaptation, there are opportunities in weather derivatives, in weather insurance, crop insurance. So there's a whole spectrum of different opportunities, and we also need to think about innovation, I think, more broadly. So another interesting theme that came up in yesterday's health discussion is, catastrophic expenditures, out-of-pocket expenditures. That's one of the biggest risks for resilience in healthcare. So many poor and ultra-poor, when they become ill, they have to take very high-cost loans, and it ends up being financially catastrophic. And how do we tackle that resilience? We can innovate in terms of designing low-cost systems for finance and having more effective credit scoring. So I think there's a wide range of areas we can think about, innovating, scaling resilience, and seeing the challenges and opportunity. Maybe now we can bring the panelists in, and maybe Hasina, you'd like to talk. I mean, let's start with you. You're innovating, I think, in a number of ways in terms of tackling the issue of human trafficking. Now, when I first thought about the issue of human trafficking, I couldn't quite make the link to innovation, but actually, after speaking to you for just a couple of minutes, I suddenly saw a lot of linkage between that. So why don't you tell us what your perspectives are?
Thank you. I think what I would like to bring about is, in the last 18 years, when I was working with combating child and women trafficking, it all just started with the issue which is out there, and it requires to address the issue in a much more comprehensive manner. And then we look back, I really realized that resources are always very slim. Every initiative which is out there in addressing human rights issues are very project-based. And we also have seen that over the years that project-based are never sustainable. And that's how the Impulse model was innovated in terms of addressing the issue and bringing a collective response of all the stakeholders, both the private, the public, and the judiciary, and how exactly they can come under one umbrella through an innovation that pull in resources, finance, and also other resources to address the issue. And that is when I got my Ashoka fellowships, and I have the team of Ashoka out here. And then I realized that innovation is something that could scale. And that scale is looking at how can my innovation go to another country so that that country who's facing a similar problem across the border on the issue of human trafficking, which is global, is an issue which is very, very global, how could they learn from my innovation and apply that in that country? Because then we are actually bringing a joint resources. It's an innovation which is already tested for 18 years, replicated in India, have seen the entire process of how it works. It went into a very global recognition. And I felt that 18 years is a long time to find a solution to address human trafficking. Why not give that to the next country? And with that, I realized that partner organizations working across are all on project base. And that's when we started scaling. in applying the model in Bangladesh, in Myanmar, in Nepal, and we felt that that was more comprehensive because after every disaster, there's always vulnerability of women and children. And that's very common across all our neighboring countries and many other parts of the world as well. And all of us are trying to address to stop human trafficking.
One other thing I want, before we go on to Tom and Charisma, when we were just talking before, I think, and when I watched the video yesterday, I mean, with my economist hat on rather than my technology hat on, but as an economist, it really struck me that, you know, it's really impressive that you are tackling a core reason for human trafficking is a lack of economic opportunity. So what really struck me about another of your innovations is that you are innovating in creating new economic opportunities for women in the seven states, in the seven sisters in India, and that economic opportunity is reducing human trafficking, but also is a new engine of growth. So I mean, maybe you could comment a bit on that.
Yeah. So like I just said, the Impulse model is the 12 pillars, which is the 6 Ps and the 6 Rs. And along with that comes the factor that do we continue to do rescue, or do we really stop and prevent human trafficking in the larger context? And that's when we started looking at what is that innovation that can actually prevent human trafficking in the long term. We might not see a result immediate, but we could see a result in the longer term. And that's when we look at the economic opportunities that you'd seen in the video yesterday, that many of the people in the Northeast has got a lot of traditional skill, and that's very much in Bangladesh. There's a lot of opportunities out there. And those opportunities can be capitalized in terms of economic, where it helped women not to migrate. And that's when we created the enterprise, the Impulse Social Enterprises, which actually target 30,000 artisans. And in the last 7 years, we've seen that these women didn't take the option of migrating even after floods, because they find that market was available in their home. So you're giving them opportunities, and we're also addressing resilience so that they could live within that situation, but yet are empowered enough to make a decision not to go.
Great. Well, Tom, maybe we can bring you in now, and in a sense, I think we've not yet had well, let's say just a donor perspective, but I think a government perspective. And I think what I would find interesting is when you look at it from either donor or government perspective, you experience in quite a few countries, as well as Bangladesh, and DFAT is active in a very wide range of countries. What is your perspective in terms of how you think governments or donors can help catalyze innovation and help scale resilience?
Okay, thanks, Sifty, and good afternoon, everyone. I must say I feel a bit fraudulent sitting amongst so much expertise on innovation at this panel, but from a bureaucratic perspective, from a Canberra public servant, I'll give it a go. I think a government role is around, I guess, trying to facilitate and help rather than getting in the way of the private sector, who are, because of their profit motive, have a specific advantage in finding solutions. So if we can help those solutions, that's I think a government role. And I think thinking about this panel before we started, I thought it might be useful just to think on first principles again. Why is resilience important? Why are we talking about resilience? And I think it's obvious, but it's worth probably restating that if without resilience, there's inequality, and with inequality, actually economic growth is constrained. So I think if we can provide more opportunities for a greater number of people who perhaps don't have those opportunities every day, it's actually good for the country's long-term goals in its, in the case of Bangladesh, reaching middle income within a generation. So I think from a government perspective, we try and select our partners carefully, and we look for partners who have an in-depth knowledge of the context. I think one of the things with resilience and innovation, for it to be successful and sustainable, it needs to be based on a really in-depth knowledge of the culture and the context There's a famous saying, culture eats strategy. It's all very well having a nice plan and a nice strategy, but without an intimate knowledge of the culture that you're working in, your solutions will fail. This morning we're talking, some of the people were talking about disaster response. We're talking about the importance of dignity in providing responses. So that resonated with me, because I think quite often as donors or as development partners, we can come in and think we know what we're talking about and push a solution. But if it's not built around the particular nuances of the culture and the community, you're not going to get anywhere. And I think Bangladesh is blessed in many ways with really vibrant civil society, and a civil society that understands the culture it's working in, but also the successful organisations, the ones that have been around for the longest, understand the community level, but also understand the systems and the networks that are at play and the power dynamics within those cultures, and they use that information to build sustainable solutions. So providing an intervention at one level, but also thinking about the various steps in the value chain that are all critical to making that a sustainable solution and facilitating that. And another point, obviously, is I think you've already mentioned it, Ifti, the scale. The country like Bangladesh has a ready-made market almost everywhere you look, and I think that goes as well for the social enterprises that base their solutions around an in-depth knowledge and community-level presence. So for a donor like Australia, we have a very small presence in Bangladesh, but we work with partners like BRAC who have large presence at the community level, who can build their solutions around that context. I'll stop there.
Okay, great. Thanks, Tom. That was very, 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 very helpful insight. We apparently only have 20 minutes left, so I want to make sure also we have plenty of time for the audience to make their contribution and ask questions. So, Charisma, I was so impressed by your. We were both in the last panel discussion, and actually I said to Maria, we have to have her on this panel because. So I guess it wasn't just talk is cheap, but I think I was very impressed by what Vota's doing. But just very quickly, because so we can get time for audience participation. I think it struck me right away that Vota's is scaling resilience using mobile technology in a very large way in many countries, and I think that you're innovating quite a wide range of fronts, and you're actually using experiences in one country to convert, to build programs in other countries. Maybe, Charisma, you can give some thoughts on the opportunities from scaling resilience.
Yeah, absolutely. So just a bit of brief background on Voto first, so you have an understanding of how we scale. So we actually use mobile technology that everyone already has. So, just your most basic mobile phone. It doesn't have to be a smartphone. It doesn't have to be a tablet. 1996 Nokia phone will work. And basically, we send pre-recorded voice calls to provide either, behavior change messaging or do data collection. And so, what this means is that basically we're able to access people in really remote areas, all around the world. So for example, some examples I gave in the last session are, we have an agriculture program in Ghana that we're actually scaling to Tanzania as well right now, where we're targeting farmers with information on everything related to the agriculture cycle. So from when they buy the seeds to when they plant to when they're supposed to plow, et cetera. And these messages are supposed to help mitigate a lot of the risks associated with climate change. So if there are any changes in weather pattern, farmers will get messages that go out to them, letting them know there's going to be this unexpected weather change happening, and this is what you need to do related to your crops in order for to mitigate kind of the risks associated with your final yield. And so in that way, because we are able to target people on their mobile phones, we're able to scale rather quickly and reach people who otherwise would be very difficult to reach due to, language or literacy barriers or just infrastructure challenges in terms of getting to them in the first place.
Okay, great. Well, maybe now we can take some questions or some contributions from the audience. Somebody got some roving microphones? And if I, again, because of time is short, the usual cliche, if you can keep your comments or questions extremely brief. And as an investment banker, I have no problem being rude and interrupting anybody that speaks too long.
If there aren't questions, I can say more about role of government and private sector and scaling.
Sorry.
I'm Saif from BRAC, Urban Development Program. I have a question to Karishma about the impact of Voto's work. Can you give us some specific example of your work that impacted positively in the community or somewhere? Thank you.
Yeah, absolutely. Great. Do we want to take other questions first, or
Oh, yes, sorry.
should I go ahead?
That's a good point. We're taking an extra 2 questions. So another 2 questions, we'll take them all at the same time. Any other questions?
Everyone wants to get to lunch.
Everybody wants to get to lunch. Glucose deficiency?
So thank you very much for nice presentation. My question goes to Hasina, maybe. Yes, you said that you have mentioned even in the video that this economic crisis in the community level drives create much scope for the traffickers. So my question is, how would it work if trans-boundary committee to protect the traffickers can be built up and work together? Thank you.
Okay, should we, Hasina, do you want to take that first, and then we'll discuss the impact of Voto?
So I think what I understand clearly, your question is about cross-border. Is that it? I mean, is that the question of how do you address cross-border? I think the Impulse model has worked over the years to work towards addressing cross-border. And the second part of the economic aspect, we realize that many of the people move and migrate to unsafe destinations because of employment opportunities, very often because of disasters, national calamities, that people have no more resources back in their own home. And that's what led to a lot of people to migrate. And that's the larger context, whether we are talking about Bangladesh, we're talking about Nepal, we're talking about India. Having worked in the sector for a very long time, we have seen the mapping exercise that we have done, that if we provide them economic opportunities within their own setting, will that reduce human trafficking in terms of unsafe migration? Will it give choices to women not to migrate? And that's how the economic generation activities, which was targeting more on the business model mode. And the innovation was basically how do we provide an economic sustenance, which is much more larger in context of market and sustainable market. When we talk about sustainable market, we are talking about I as a woman who have traditional skill is being able to receive money in my home, even, no matter what, I'm still getting my money. The product is being taken care in terms of sales. That has helped us over the last 7 years to see the reduce of migration, because women felt that why should I go out if I have my economic opportunity in my home? But we had to really make that much more larger in context, and when we work in business, the economic of business is about quality, is about quality control, is about manufacturing, is about weaving, is about merchandising. Then we collaborate and innovate further with other existing innovation and bring into one platform to see traditional skill is actually being value added by other sectors. And that has helped a lot in terms of preventing human trafficking. And across the border, I'd just like to add that we have a technology that we have introduced, which is called the Impulse Case Info Center, a software, and that has just been launched by my team here in Bangladesh just 4 days ago, which our partner here is applying that. So it's a technology which is called a case management system that help country to connect in terms of addressing human trafficking. So that is also how technology evolves, because if you have to address cross-border, you can't keep running across the border. By the time all the legalities has to be completed, the person's already trafficked across the border. How do you stop that? How do you get the other country to respond to that? So that's where we had used the Impulse Case Info Center, which is a software that allows a platform of all the stakeholders to work together and take on how messages are passed, cases are being referred. It's one data case management, it's one hub. So it helps a lot to also see that we address that across the border using technology.
Okay, great, Hasina. Kristen, how do you measure Voto's impact?
Yeah, that's a great question, because I do think that measuring impact when you're using technology a lot of times can be, tricky. How exactly are you supposed to, and in general, measuring impact in the development sector can be tricky at times, especially when you have a behavior change program, for example, where you're telling people that they should be washing their hands with soap. How are you measuring that? Are you doing self-reported behavior change? So are you, calling people up and saying, did you wash your hands after you went to the bathroom yesterday? Or are you actually, going door to door to their house and, doing kind of these random visits to see, what their lives are actually like? So I think in general, impact is really difficult to measure. And then adding on the technology piece, it definitely gets harder. But one thing that, an example that I'll give you is a maternal health project that we were running in Ghana with pregnant women, where we were targeting them based on how far along they were in their pregnancy. And so these are women living in very rural northern Ghana who otherwise don't have access to, doctors and that sort of information. And so we would send them weekly messages saying, this week you should be eating this type of food, or next week, remember to go to your antenatal care appointment. And one of the key metrics we were looking at is the number of women who gave, the percentage of women who gave birth in clinics as opposed to at home. And what we found is that compared to the national average of women giving birth in clinics, which stands at 51%, the women in our program, actually, I think it ended up being something like 86% of women in our program ended up giving birth in clinics.
Yeah, I was just going to add one, just to reinforce your message that it's about the impact, and the challenge of even in the project that we're working on, you can have we have very sophisticated algorithms that having an AI system, at the end of it saying to make a decision, okay, you should you should immunize, you should change you should breastfeed to a mother. It might talk about stopping smoking. It doesn't matter, but ultimately it's not about the technology. I think that's what you said, which we also are grappling with, because however we come up with a recommendation, whether it's using an AI-based system or a doctor or however, the question is, how can you impact change? Does that person who's receiving that suggestion, does he or she actually act on it? Right. So whether it's with a mobile phone or a tablet or an AI system or a doctor, we have to recalibrate what we do. So you might say, okay, we're going to play somebody a video, or you might say you're going to give somebody a written note, or you might say the help. Which is the most effective is an empirical question. Yeah. But I think that many development programs and many people, especially in technology, get lost in the technology, not about the end goal, and lose track of that.
Yeah, absolutely. And I think that one of the things that we think is really important to do is also test out the program, right? So not just make sure, or not just push out a program once, and then kind of have this baseline and end line, and that's it, right? So you need to keep iterating on the content, and that's something that we do by getting feedback really regularly in our programs. And so we ask people, comprehension questions, we ask them self-reported behavior change questions, but then we also very regularly get feedback to say, how helpful is this information that we're sending you?